second and fourth Wednesday of the month in conjunction with Commod Cancer Foundation. April is almost over.
Yeah.
April.
Yes. It's fast spent.
Indeed.
Well, this Wednesday, our focus is a must-know on prostate cancer. The founder of the Commod Cancer Foundation, Dr. Dennis AJ, has with him a chief consultant clinical and radiation oncologist, Professor Bello Abubakar Mohammed.
Welcome, Professor, and welcome, Dr. Dennis AJ. Good to have you this morning. Over to you.
Good morning. Morning, everyone. Thank you. Good morning, viewers. Welcome back to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Common Cancer Foundation in partnership with the IT. Together we fight, together we win. A must know on prostate cancer. Let's start this day with a very good welcome. Good morning to our guest, Professor Bello. Good morning, Prof. Can you hear me?
Good morning, and thank you for having me. Good morning.
I can hear you now. So that's nice. Ignoring prostate cancer won't beat it. That was a quote from Chuka Umunna. I don't know how many people know who he is. But anyway, let's start this conversation. Prostate cancer is one of the most common types of cancers. Many prostate cancers grow slowly and are confined to the prostate gland, where they may not cause serious harm. Today we're going to be hearing a lot more about it, and we're going to be educated by the specialist himself. Let's start this conversation together. We fight, together we win. Share, subscribe, invite your friends, and let them be part of this conversation. So let me introduce our guest. Okay, our guest is Prof. Abubakar Mohammed Bello, Head and Chief Consultant, Clinical and Radiation Oncologist, National Hospital, Abuja.
Right.
Prof, I haven't started. Let me do my own.
No.
Prof is a trained and certified clinical and oncology radiation oncologist. As head of the department, he has spearheaded the establishment of the first modern radiation therapy department in Nigeria using a CT simulator, using Electra's Monaco 5.11.1 treatment planning system. I've heard of that. That's interesting. I'm not a doctor, but I've heard of that. He's part of the African Oncology Coalition that has been working to harmonize National Comprehensive Cancer Network, that's the NCCN guidelines for Sub-Saharan Africa. He's also the chair of the Prostate, Colon, Rectal, and Anal Cancer Guidelines panels, a member of the Neuroendocrine, Pancreatic, and Adrenal guidelines. You see these medical people, your English is much. Currently, he's the principal investigator in 54 gene heritage studies and a gene expression profiling of non-communicable diseases in Nigeria. There's a lot going on with Prof. So, Prof, thank you for your time. And you can understand, I don't make any statements that I know these your medical terms. I don't know them. They are too complex. Your words are too complex. So let's sit back, let's relax, let's listen to what Prof has to say to us this morning. He's the one, he's the specialist. So thank you all for joining us once again. Let's remain united against cancer, as together we fight, together we win. My first question. What are the current statistics and prevalence rates of prostate cancer in Nigeria? And how are we looking at reducing them? It's very quiet questions, because the next one are the main ones.
Thank you so much. Thank you so much, Dr. Dennis. I think you have tried not being a doctor and calling all these job-breaking names, actually. Suffice to say, prostate cancer is the #1 cancer in males in Nigeria and indeed in sub-Saharan Africa. Yeah, so it is the #1. Statistically, there are over 40,000 that are diagnosed every year. But that statistic is basically an assumption, because we have, established now the National Cancer Registry, but a lot of the country is not really covered. So it is based on statistical figures that we have these numbers. I want to believe that from what we see in our clinics, that the number is really, really higher than that. A lot of misdiagnosis here and there, not even diagnosed until, the person is gone. So it's the number one cancer actually in males. It's actually the number 3 cancer generally when you consider male and females. Breast cancer happens to be the number 1 cancer in Nigeria generally, followed by cervical cancer and prostate cancer. So it's a very serious medical issue that really need to be tackled. I don't want to deal with big statistics because they may not be too relevant.
Correct. Thank you. I really like the way we started this, because one of the things that we need to always recognize, and this is for men, I always like to make them understand that we're having this conversation because men are the dads. And with a lot of misinformation, they can make wrong decisions, where women will have their breasts removed for their children. Are men able to do that? Anyway, let's go on. What are the common risk factors? Because these are things that bother men associated with prostate cancer amongst Nigerians. But before you answer that, can you please explain what it is? What is this prostate cancer?
Okay, so let's start by understanding where is actually the prostate gland. So the prostate gland is a gland that is the size of a walnut, that is located just beneath the bladder, beneath the bladder. And its main function really is to nourish the spermatozoa during ejaculation. So it has some substances that nourish the sperms, as it were. And so that is the primary function. And sometimes as you get older, these glands tend to start growing. And for so many other reasons, which we are going to discuss, it starts to grow, and then it will now, because it is under the bladder, right under at the neck of the bladder, it will cause a lot of damage around the when you're passing urine. Okay, so most of the symptoms that you have are connected with urine passage. I'm trying to break it down as much as possible so that people will understand. I don't want to use the jaw-breaking vocabulary. So that is not why we're here. So that is where the gland is. And cancer in itself is termed as uncontrolled development of abnormal cells. So that is where you need to understand immortal cells. Sometimes for one reason or the other, a part of you becomes immortal. The cells in the body are controlled regularly, by the genes. So when the genes cease to control the function of those cells, the cells become abnormal and they start to develop and continuously develop. So they become uncontrolled. They become immortal. And when they become immortal, they continue to develop, and that is called cancer. Okay? So if it's in the prostate gland, then it is called prostate cancer. If it is in the bladder, it is called bladder cancer, and so on and so forth. Now, why do men have this high prevalence? Now, there are a lot of, we may not know the real causative agent or the real cause of it, but we know that there are a lot of risk factors that are attributed to the development of prostate cancer. The number one thing I must say is black race. Now, 1 out of 4 black men will develop prostate cancer in their lifetime. And that is very important to note. 1 out of 4 black men will develop prostate cancer in their lifetime. Unlike the Caucasians, where you have 1 out of 7. So it is a black man's disease. We've been doing a lot of studies to find out exactly why. One of the theories is that black men tend to have a very high level of testosterone. Now, testosterone is the hormone that nourishes the gland. So persistent effect of the testosterone may predispose to the development of prostate cancer. Now, these are hypotheses that are, ongoing. Research is ongoing to really confirm this. But that is what the pointer, really, that black men tend to have high level of testosterone, high virility, and as a result, they develop prostate cancer. So this is one of the risk factors, race. Okay. The second thing is age. As you get older, the chances of developing prostate cancer also is much higher. So this is the second thing as you get older. And that is why prostate cancer is usually detected in old age, even though we start checking for prostate cancer from the age of 40 in black people, from the age of 45 in Caucasians and other races. So that is the second risk factor. There are other risk factors, like dietary, obesity, when you are fat, the fat cells tend to produce those hormones, and that can actually predispose to that. Inactivities, sedentary life, some diet also have been attributed to the development of prostate cancer, like very high fat diet, tend to predispose also. And high fat diet will predispose you to obesity, right? And as a result, you could actually have prostate cancer.
It's interesting. It's interesting listening to the facts. So basically, one of the first things we all have to accept is the fact that it's high in black people. So black people need to be ensuring they are doing their screening at the age of 40. So a typical Nigerian man should make sure that whatever he does at the age of 40 to prevent him, or at least give him a chance to kill it before it starts, or before it gets into an issue, should make sure screening is done at the age of 40.
Yes. And there are those that have family history as well. I think it's critical, I should mention it here, that, if you have a closer relation that has had prostate cancer, chances are that you could also have prostate cancer. Because there are some genes that you could just inherit, just like in breast cancer. Okay, so that one too is very important.
Okay, so this is for men now. We have to also focus. No, we have to get the facts right because we're doing a serious conversation here today. Okay, so the next one, may I have a dad? I have some brothers, and I hope one of them is listening to this now. I'm sure he is, or his friends will tell him. What are the available screening methods for detecting prostate cancer in Nigeria, and how accessible are they to the populace as of now? Because me, I'm a woman, and I know the one for women.
Right. So the first thing is that we have, I was part of it, develop the national screening policy at the Federal Ministry of Health. Even though it has not been institutionalized for lack of funding, prostate cancer screening is one of them, just like breast cancer and cervical cancer. And the first thing that you need to do at the age of 40 is to see your doctor, you see your physician, who will do what is called digital rectal examination. Now, the prostate cancer can be assessed through a digital rectal examination. So it's very close. You can examine it through the rectal examination. I know it's very uncomfortable for some people, but you go to your doctor, he will stick a finger, and then he will feel the consistency of the prostate gland. He can easily assess it through the rectum. And that is the first thing that you need to do. And then, of course, you need to do what is called the prostate-specific antigen test, commonly known as PSA test. It's a blood test, simple blood test, where you check the values They have standards, 0 to 4 nanogram per deciliter is the standard. Anything above that is a call for concern. Of course, let me hasten to say here that there are other conditions that will elevate the prostate specific antigen. And it is important to note that, ejaculation in itself can actually raise the prostate specific antigen result. And also horse riding, bicycle riding, anything that will excite the prostate gland could actually cause that. So if you have also an infection, prostatitis, that could also raise it. And that is why you need to see a doctor before you decide on going to do the prostate-specific antigen test. That it may just save your life. A lot of people have a lot of, we have not started talking about symptoms, but they don't simply remember to do that. And one of the awareness we've been, canvassing around prostate cancer is, you are age 40, please every year try and do your PSA testing. That may actually save your life. If you do that, you can get the disease early and you can actually cure it. It's a very slow growing disease. It's indolent. And if you are able to catch it early, you can actually live with it, even if it is not cured. You can live 40, 50 years with the disease. It's just like diabetes or hypertension, and then you can live with it. The problem we always have is that people don't prevent early. So yes, it is available. You talk about availability. Most of diagnostic centers can actually do a PSA testing. It's simple blood test, and it's readily available across most of the urban areas. But we need to institutionalize it. We need to make sure that government has taken it up, from local government to state governments to federal government, so that even people living in rural areas can actually benefit. Because most of the patients that present in Nigeria are late-stage diseases where you cannot help. So they are available from there.
Prof, can you also do the symptoms now that you're talking, so that we can take treatment after that? Yeah, let's look at the symptoms.
So like I mentioned, most of the symptoms are urinary symptoms. When you first start going to the toilet and you have difficulty passing urine, there is what is called hesitancy. So you have to wait for a few minutes before the urine starts coming out. That may be a warning sign that the prostate gland is enlarged. Doesn't mean 100% that it is prostate cancer. And then gradually as keep enlarging, then the passage of urine become almost impossible. Sometimes somebody will have to strain a lot before he will see any urine coming out. And the second thing is that in fact, sometimes you can't even pass the urine, and it may be the only symptom that will take you to the ER, the emergency room. So very important. You notice your urine is not coming out and you're having difficulty, you must see your doctor. Or when it is advanced, then you begin to see blood in the urine. Okay, we are in a region where we also have other diseases like schistosomiasis that could also cause, blood in the urine. But if you are above the age of 40, 45, the average age is about 50. So if you see blood in your urine, you have difficulty passing urine, and then you begin to see blood, then you know that it is a red flag. Sometimes during ejaculation also, you see that it's not only the semen that comes out, but also there is blood. So that also is a red flag. And in fact, in most cases, a lot of patients don't even have symptoms until the disease is really advanced. That means it has spread. Okay, and then one of the things that they begin to have is back pain, persistent back pain. That means the prostate cancer has gone out of the prostate and it has invaded the bones. So that is the primary area of call. From the prostate, it jumps to goes to the other organs around it, like the seminal vesicles and all that, the bladder, the rectum. But sometimes it just jumps and gets into the bones. And the patients present with severe backache. So they always go to the orthopedic surgeons. And sometimes you do a CT, an X-ray, or you do an MRI, and you see that there's destruction of the vertebrae, and you want to do surgery. It is important that you must do a PSA. That is the catch. When you do a PSA, then it will show probably. Of course, there are some prostate cancers that also don't have elevated PSA, but I don't want to go into so much detail because people will be wondering, okay, so what do we do?
No, but you know what you're saying, it's quite straightforward and clear for viewers to understand how to navigate this. Okay, so now that you've explained all this to us now, okay, so treatment options now, and what are the are there any challenges, and if there are, what are the challenges for quality treatment, for accessing?
So yes, statistically, we need to recognize this fact that the cancer itself, especially prostate cancer, breast cancer, are growing at an alarming rate. Okay, and it is assumed that by 2030, 85% of cancer deaths will be in low and middle income countries such as Nigeria. While it is going down in wealthy countries, it is going up in countries like this. And the reasons are not perfect. One is lack of awareness. People are not really aware of the cancer itself. There is denial. A lot of people are also in denial and they are scared. Why are they scared? It's because they feel that the diagnosis of cancer, any cancer, equals to death. And that is not true. So yes, it is important that we understand why people present very late. And those are some of the things. Okay. And there is also lack of awareness that you can actually cure cancers, including prostate cancer. You can cure it 100%. And of course, there is financial toxicity around treatment. Somebody next to you will be telling you that, it's better you don't even start because it is so expensive. So there is abandonment of therapy as one of the risk factors why these things are going up and people are dying of it. But there are a lot of treatment options, Detected early, you go to the hospital, see your doctor who will refer you to a urologist when he realizes that you are PSA. So you start with the primary health care, see them, request for a PSA testing. It is highly elevated. You are above 40, you are above 50, you are 60. You will be referred to your urologist. The urologist will do a biopsy. He will take a chunk of that tissue. He will insert a needle and take a couple of tests, and then he will analyze that. And once it is confirmed that it is prostate cancer, the treatment starts. And you do what is called staging investigations. You want to know the extent of the disease, and that is why they keep telling you, go and do this CT scan, go and do this MRI, and so on, is to define the extent, of the disease. Some people will come to me and said, what is the stage of my disease? I said, that's for me, really. If I said it's stage 4, then what do? Do you run away? Certainly not. Because even stage 4 diseases can actually be managed. It is part of the 4 pillars of cancer care. You prevent those that are preventable, you treat those that are treatable, you cure those that are curable, and you palliate those that cannot be cured. But prostate cancer, being an indolent cancer, slow-growing cancer, can actually be cured at many stages. So, yes, there are available treatments. First, you start with the urologist, who will start with giving you some medications to bring down your testosterone. Okay? Because I told you that testosterone, the hormone that feeds the cancer cells. Okay? So you deplete that. And by so doing, you make the cancer cells to die. When it has gone beyond, and there is option also of surgery, okay, if it is still confined, even though we hardly see most of them like that because people don't do screening and people don't come out when they even have the cancers. They tend to hide because they said, I reject it. It's not my portion, and all that and all that. So by the time they have no option, they are being wheeled, in a wheelchair into the departments, then you have no option than to receive all the treatment. And of course, the oncologists have a very important role to play, because most of the treatment of prostate cancer is confined within the clinical and the radiation oncologist, where, if you don't want to do surgery, even for early prostate cancer, you want to do radiation. So he will make an assessment and give you an informed, decision-making options. So radiation is also part of it.
Well, thank you, Prof. We're rounding up now. I need to round up now. That's why I'm...
I can see that. Okay. So there is tablets. There are injections that you need to do to kill the cancer cells as well, and radiation. And these days, even the most advanced of cancers can actually be treated. It's what is called theranostics, the use of nuclear medicine to cure prostate cancer that are really, really advanced. And these are things that we hope we will soon have. So even if it is so advanced, do not despair. Don't say that you are confined to die. There are options of treatments that people can actually get. And we're getting, and in Nigeria also, some of these things are actually...
And now here. Yes, I know. I've heard. Yes. The robot is even in Nigeria. Thank you. Together we fight, together we win. Prof, thank you very, very, very much. Our time's really gone fast. And to viewers, you can always come back and watch the video when it goes online. Follow us on our social media platforms, and you will see what's been going on. Connect. We're going on a serious discussion about prostate cancer for this year. So please, men, please listen to what's going on with prostate cancer. Prof, what did you want to say before I close?
Yeah, so I wanted to mention that at my university, the Federal University of Health Sciences, Azare is in Bauchi State, we are trying to develop a genomic research institute where we'll be doing all the genetic testing around prostate cancer, breast cancer, and I think people should really come and support us so that we will make it a reality. And we'll be treating individualized cancers after that.
That is very nice to hear. And thank you all viewers for watching us today. And thank you, Prof, for your time. And to everyone, we'll see you again in 2 weeks. But have a lovely, lovely day. We've really run out of time today. Together we fight, together we win. Subscribe. You can find us on any of our social media platforms. And the video will be up sometime today. Take care of yourself. Have a fantastic day. Thank you, Prof, and have a lovely day.
Thank you for having me. Thank you.
Our message is very clear. Together we'll fight. Together we win.